As the person who will need to help work with you and synthesize this information and really take action on it, I'm going to share with you some things that are bubbling around. And as I think about how to use this report, move forward, I first want to actually say that I'm the type and quality of folks that have participated. I think anyone who's left in the room who's from our office and from VHA, Veterans Health Administration staff, feel overwhelmed, excited, and surprised that it really has given us a view. Some of us that really are in VHA working day to day. I've been a physician in VHA for 22 years. I originally had this conversation with Dr. Kaiser last fall and thought about this as an opportunity to learn what VA needs to do, because from my view, we are a very large system, as you heard, and I don't think that we function as much like a system as I thought that we could function. I come to find out, as of yesterday morning, that there may be some similarities. I just thought that we were the only one. So it's a little comforting. But what I really began to think about a little bit more, in addition to what is our unique aspect, is really the mission of what we're doing. And I was really that reinforced when I picked and Adrian as a part of our group, but the people that were up here, the commitment and the passion about taking care of veterans remains to be a core part of the employees that we have and the veterans. And so that's a strength of ours. I think we need to, and that strength leads to a comment that one of the business owners made to me, which was that it really is 90% about the people and 10% about the technology. And so that's not something that those of us who are practicing, physicians and clinicians walk around thinking about every day, but that was pretty poignant for me. So that was something to think about. Now, 10%. I think we could do a better job with the 10% that we currently have. There are a number of stovepipes, and as we move into Cerner full suite implementation next spring, and then the accelerated scheduling version into the fall, I thought about the technology and what would be the best for our system, or perhaps a start. I was very impressed by the machine learning and algorithms and the experiences that I heard, and really intrigued by it. I'm really this operations action person, for those of you that know me. Okay, what do I do first? And I'm still seeking some further clarity. Perhaps the report can elucidate some of that around where do we start getting going to move us into action as maybe some initial steps with some of the technology. And because I really felt like today we heard a little bit more about the operationalization in a health system. That's actually really helpful for me, but also really intrigued about pulling some of these, what we heard about the machine learning and from yesterday, the modeling. And so as I moved into, I think, this last session and thought about that, I wanted to comment that having a frontline this morning integrated project team really was a light bulb for me. Unfortunately, in central office, the people that I have access to the most are people who are clinicians who are now administrators, and people who experience this not just a half a day a week, but really are experiencing scheduling, being a scheduler, and working in an oncology clinic is really the real deal to me, and what we really have to start pulling together and thinking about. And then really the session prior to lunch was definitely okay, let's do this, because the strategy part of me wants to think about things like, and I talked to Dr. Hayworth about this, and Oliver, can we take ZocDoc and do a virtual, ZocDoc system for specialists? Let's do it. She's got the hubs. My mind was going, because I think truly the opportunities exist, and I didn't really have a real appreciation of what was out there. The number of clicks to actually complete the appointment, right, is definitely something that is truly inspirational to those of us that are in Access have done scheduling and have been in VHA. So kind of in conclusion, I would say that your point about change management, and I continue to hear about communication, is really something that I know in a lot of my experience that we have to, even when we think we've done enough, do more. But I see this as a very exciting path forward, and I want to thank everyone here who really has helped us think about this, and I hope this isn't the end and that we may continue to solve some of these problems together. So thank you.